chiropractor and an orthopedic doctor and all of that, you need a hematologist, oncologist. You need a blood and cancer doctor. And so we're going to hear about that from Dr. Pranima Pandellapalli. Ah, I got that right. Yes, who is a hematology oncologist. Thank you.
So that was very good pronunciation of my name right away. It took me almost 5 years plus time to get all the L's and I's in the right form. So thank you so much for having me here. This is my first time with this group, and I am really honored to be here. It's a privilege, it's an honor to be here, to be able to participate and to be a part of this group of people who are amazing. As I'm listening to hearing the stories from our wonderful speakers ahead of me, so energetic, so positive, it, it motivates me. So I am a hematologist oncologist. I was born and brought up in India, and I came here almost 22 years back or so, and lived half of that time in Kansas, and finally left it. Uh, we are still in Kansas, or no? And where I did my all of my training, internship, residency, fellowships, and all that fun stuff. So ultimately, I become a hem physician, and then I came to this area and practicing since then. So that's my story. So now let's get to the business of what do you need to know and what can I tell you? I did not prepare for the speech at all because I don't think there was a need to do so. The same thing, the way I walk into a patient's room, I know the history, I know the chart, but I don't plan ahead of time what to offer, what would be the best step, and those kind of things because everyone is different. So my take home message will be, and I say this all the time, I am nothing but a good tailor. I just know how to cut that piece of cloth to fit you the best. You cannot buy or you cannot get one size fits all kind of thing because it won't be the right thing. So someone who's ready to listen to you, hear you out, and again the symptoms as far as that goes, it can be anything. It could be again I really believe that multiple myeloma has many different subtypes. We are in the evolution of the disease process and we'll come to know of those subtypes soon, I'm sure, and we are with the genetics and everything. But there are two major types in my opinion. One type that you just heard the two patients, doctors and patients tell us here about excruciating pain, bone breaks down, and that that's an extreme. And again, these are young people. That's an extreme type of condition and needs emergency treatment. But more common, and again, I think something that would tend to be overlooked, would be something like MGUS. What is MGUS? It is a mini multiple myeloma. It's not multiple myeloma. It's essentially a protein that is in excess of what it should be. Is an abnormal protein, and if it keeps growing that way, then it will become the cancer multiple myeloma by doing its damage, which will be like calcium or the kidney and the bones and the bone marrow and those kind of things. So most importantly, I think we should also, and I'm learning this myself because it's a sort of process for all of us, that we should be screening probably for MGUS. I know we don't do that on a regular basis, but what does it take? I mean, we do so many other screening tests anyway. We probably should come up with an age limit, so to speak, the lower end of the age limit, and start doing it once a year or so, or maybe once every 2 years, 3 years, and we will catch quite a few of this MGUS because it seems like, of course, MGUS. So let's say there are 100 people with that monoclonal gammopathy of undetermined significance, which is of no value. Of those, one of them will turn into multiple myeloma every year. Okay. The other way, when you look around, every multiple myeloma originates from that MGUS. So what I'm trying to say is that the screening mammography for breast cancer, possibly a simple blood test for multiple myeloma, because I think we will find it more and more, the incidence